If your eyes are often red or perhaps your vision is getting worse, you could have a corneal ulcer.
Well, Charlotte Eye, Ear, Nose, and Throat Associates has more on this common problem.
Do your eyes hurt? Are they always red? Do you have light sensitivity? Maybe you have a corneal ulcer. Here now to tell us more about it is Dr. Vipul Shah from Charlotte Eye, Ear, Nose, and Throat Associates. First off, what is a corneal ulcer?
So a corneal ulcer is an infection of the front part of your eye, and I have my handy eyeball that I carry around all the time just for purposes like this. And the very front windshield of the eye is the cornea, and it's actually a very advanced structure of the eye and the part of the eye that focuses the light the most out of everything. And so this is where your contact lens sits on the front of your eye, just sits on the surface. And so because it's got a piece of plastic on it all day long, it can be prone to develop bacteria underneath the contact lens, which can cause infections, which are extremely painful and can be vision threatening. So it's a concern when it happens.
So is that the biggest or the most prominent cause of a corneal ulcer, is the contact lens wearing?
There are other things that can cause it too. So people without contact lenses can certainly get infections just by chance. People who have been in fresh water, they can get certain types of infections. There are also certain viral infections that can affect the cornea even without wearing a contact lens. But in general, people who misuse their contact lenses are the people who suffer the worst, most vision-threatening infections.
So maybe people who are sleeping in their contacts or not cleaning them properly, things like that?
Not replacing them when they're supposed to be. So different lenses are supposed to be rated for 2 weeks or 4 weeks, and people are not necessarily, they're kind of understandably trying to stretch out their lenses if they're feeling okay, but then the lenses break down and they don't protect the eye the way they should, and bacteria can get under there.
So what are some of the symptoms? What would somebody recognize is going on with them to know that they have this problem?
So they can get redness, pain, decreased vision, light sensitivity. Sometimes they'll even see, I had a patient just today tell me, I came in because I saw a little spot in my eye. So sometimes they'll look in the mirror and they can actually see the ulcer starting to develop, and the sooner they come in to see us, the better off they'll be.
So what are the treatments for this?
So in general, it's antibiotic drops is what we start with, and that can be anywhere from a few times a day to every hour around the clock, depending on how bad it is. For some infections, they have to have special antibiotics made up because we really want to hit it hard with strong antibiotics. Sometimes we'll use steroid drops, but in general, it's just drops. Now, in severe cases, we may end up having to do surgery. I've had to do surgery many times on people who they just didn't turn around the way we wanted to.
What is the recovery like from an infection?
So for infections, I think people are surprised how long corneal ulcers take to recover from. Most infections, like a sinusitis or something, that people are experienced with, few days and they're good. The eye doesn't heal itself very well in that area, and so it can take several days and even weeks to recover completely from an infection like that. And even then, they can have things like scars that affect their vision. So it can take a while. If we have to do corneal transplant surgery for severe infections, that can take months to recover from.
So what is the best way to prevent this from happening to begin with?
So the best way is just to follow all of your instructions for your contact lenses to a T. Clean them every night, never sleep in them, replace them when they're on schedule to be replaced, get updated prescriptions every year like you're supposed to be, and just basically make sure you have a good fitting contact lens that feels comfortable. Sometimes people have poorly fitting lenses, which are also kind of a risk factor. And anytime you have any symptoms that are concerning, don't let them linger on for a week or two. When you have a break in your work schedule, try your best to come in as soon as we can. They're much easier to turn around sooner rather than later.
Well, if you have a problem, come to Charlotte Eye, Ear, Nose, and Throat Associates and come see Dr. Shah. Thank you so much.
Thank you. Thanks for having us.
He's wonderful, Dr. Vipul Shah. Good information, right? For more, visit WeJustMakeSense.com, WeJustMakeSense.com, or you can call Charlotte Eye, Ear, Nose, and Throat Associates. The number is 704-295-3000.